My patient is going to come to this bed, and I'm going to pull the bed down and get ready for my patient to come. And look what I found underneath these blankets and sheets. There is an incontinent pad. Do I know that patient's incontinent? No, I have no idea. So this is what you should not find under a bed. My patient absolutely is not incontinent, so we're going to take this off and save it because they're very expensive. So my patient does have a problem with her feet. She is at very high risk for some pressure ulcers on her heels. The reason I know this is because we did the Braden scale and we examined this patient and we saw that she was getting a little bit of redness on her heels. Okay? You're going to examine both feet, of course, because you want to make sure that they're both okay. She happens to be diabetic. She has all kinds of different disease processes. I need a boot. This is the Prevalon boot, which we use for heel protection. It's made by Sage and it's very nice. It has a wedge. I'll show you exactly how to put this on because it's important how it's put on in terms of where the heel is going to be. So as we lift this up, we're going to put the heel right in this opening. Now this boot comes inside out, and that's how you want it when you first put it on and every time you change it. So you're going to lay her heel in here and bring the boot up around her leg. There's a wedge in the back that you want to make sure is on one side or the other as you do this because it'll sit right underneath there if you don't. You get all your Velcro together, bring the boot up. This boot is color coordinated, so you have black and white. You take off this little strip. This black is going to go over to the black. Bring it tight, make sure the heel's in the right place. Now, if by chance your patient is very obese, this is going to be too tight against their leg right here. It may cut in on their leg. So we're going to be having, and we will have, the bariatric boots that will be a little bit bigger. So now we're going to take the white strip and go over to the white side and put it rather tight. It won't hurt the patient if it fits correctly. I like to do a little shake here just to get the foot down in, feel where the heel is, making sure that the heel's not touching the bed. This little black part is to prevent foot drop. So you're going to tighten this as tight as you can to keep the foot upward in an upward position. Now this patient has a tendency to rotate laterally, so I'm going to put my wedge on that side so she can't go against this side of her foot. She probably has an ulcer right here and I want to protect it. You don't need to have pillows. You don't want to have pillows underneath these boots. If you put a pillow underneath the boot, it's just redundant. It defeats the purpose of the boot anyway. The other good thing about these is if the foot is small enough to go down under this part, you don't need a foot cradle, which is really nice because then it's protecting the toes. You're just going to take off your little Velcros and it's going to automatically want to go inside out, which is very convenient because then you take the foot out, being careful where you set it, take your boot and you're going to want to get some of the scaly skin and stuff out of the boot so that it doesn't sit in there and cause more problems. Now I'm going to leave this off for a little while and let, check her circulation, clean her up, whatever. When I put it back on, it's already inside out and ready to place the heel in place right here. This is a demonstration of how to properly float the heels. If the patient is completely immobile and is not going to be kicking this around, you want to make sure that you use 2 pillows, one for each leg. You properly place it without being underneath the knee, and then at the end of the pillow you can actually curl that part up a little bit so that that heel is not touching anything at all. Okay, and you can see, you can put your hand under and make sure. You want to do both legs, and normally I would go on the other side, but you wouldn't be able to see it then. Both feet, different pillows, and properly offloaded off of this bed. Now if you do this, you're going to need to have a foot cradle to keep from pushing down on the toes, because that can actually put pressure on the toes and make pressure ulcers there as well. This is a demonstration of how to turn your patient at it and to put on to use the wedge to prop the patient up. First, note that if the patient was extremely heavy and not the helpful Kathy that it is, I would probably ask for help before I did this. Okay, so we would use the draw sheet. We would ask that the patient, this wouldn't be in the way either, we would ask that the patient reach over towards this way, bend this knee up, and we would rotate her this way. Okay, in order to keep her that way, we're going to take our wedge, and this wedge can be placed depending on where her wound is. If she has a wound way up here, I'm certainly not going to put the wedge there. If she has a wound on the sacrum, I'm going to go above the sacrum with it, and then I may take another wedge and go below that, and just to keep the weight off of that part. I may even use a pillow to go between the knees, or even another wedge. Then I would let the patient come back, just rotate back onto the wedge. This can actually help with her elbow. She can position that way. I would definitely have a pillow between her knees. Let me grab one of those. And as you can see, that keeps the patient on her side without being up on the hip, which you don't want. I would actually rotate her back just a little bit further. How's that, Kathy? Okay, and she's on the bony, or she's not on the bony part of her hip underneath. She's at about a 30-degree angle, which makes it so that she's on the largest part of her buttocks. And then I would, of course, put a pillow under here, keeping the heel off of the bed. In order to protect these these wedges, you can either put the draw sheet back over here like this, and maybe even put a pillowcase on them if you'd like to really protect it. If they get soiled, you're going to throw them away. If the patient's incontinent, you're going to be using a pad underneath and protect them as best you can. And when you are using pads underneath incontinent patients, only use one. It definitely makes added pressure to put more than one, and it also makes it so that if it is a low air loss bed, it's not going to function correctly. So don't be afraid to throw these away. If they get soiled, just toss them and get a new one. Okay. When repositioning the patient, make sure that you check for several things. First of all, there could be a foreign object in the bed, you know, a cap to a pin even, or a cap to a syringe, or a syringe itself. Make sure you check for that. Make sure everything is nice and smooth underneath the patient. You also want to check and make sure if they're incontinent, and make sure that that is taken care of at the same time. If your patient has any tubing, for instance a Foley catheter, you want to make sure that you have the stat lock in the right place. Make sure that tubing is not underneath the patient. That can make a pressure ulcer as well. Any JP tubes, chest tubes, anything could get under the patient. SCDs is a real dangerous risk. It puts them more at risk for a pressure ulcer because of the tubing from the SCDs getting under the heels. So be sure and check that as well when you turn your patient. If you're turning your patient every 2 hours, that patient has every bit of that checked and is safe for the next 2 hours.